So a little earlier we talked about the importance of gamification in promoting sustainability. This panel is about gamifying health. And again, this is one of the areas where this stuff really matters. Getting people to change their behavior, become healthier and more environmentally friendly. This is the power of gamification.
Well, I just want to welcome everybody today. My name is Amy Pugliafito. I'm with Rock Health. We're a digital seed accelerator for healthcare startups. Today we're going to be talking a little bit about the gamification of health, driving behavior change and outcomes. So, let's put this down here. So, please refrain from asking questions until the end. We're going to have a brief period of time for questions. We're a little squeezed in for time today. So just to get a general sense of the audience, who in here works in healthcare? Okay, so we have a couple hands. How many of you are entrepreneurs? All right, interesting. Okay, and developers? Okay. So hopefully we'll be able to give you some information about what gamification looks like in our industry. So let's just start by going around and you guys can introduce yourself and say a little bit about something that applies to gamification in your company or product.
Start here?
Sure.
Good. I'm Lance Henderson. I'm the CEO with Zamzee. What Zamzee is a social enterprise that is focused on getting kids and families to be more physically active. And I think what's probably worth saying just as a starting point is what we've done is really deeply informed by the research that was done by our parent organization, Hope Lab, which is an organization that is deeply committed to trying to get kids more physically active and help address the childhood obesity epidemic here in the United States. And Zamzee is sort of a byproduct of that we are trying to take out into the market in large scale, and I can get into in a bit, but our sort of principle is lead with fun and health will follow. And so gamification is all over our site, all over our experience, and using those mechanics to try and impact behavior change.
Great. I'm Bob Plourde. I'm Vice President of Innovation and R&D with UnitedHealth Group. My role is basically to go out and look for opportunities, innovations, new things out there to figure out how do we bring those into the healthcare space. One of the areas we're focusing on very heavily is engagement of consumers, engagement of members, people in their healthcare. So for gamification for us, it's all about what can we do to change the way people are engaging in their healthcare? Can we give them things that will motivate them, incent them, and get them to do things in their healthcare that they wouldn't traditionally do? Things like a Zamzee. Could we employ a Zamzee product with part of our population and get them to really go out and do very different things? Or other things, whether it be for a pregnancy population, whether it be for people around health and wellness, whether it be health education. We're looking at gamification for all those types.
Great.
And I'm Rebecca Woodcock. I'm the founder of a company called Cake Health. We have a web service that helps consumers keep track of their medical expenses, their deductibles, their out-of-pocket costs, and ultimately looks for ways to save them money on healthcare. And we didn't intentionally think about gamification necessarily when we started out, but we were concerned about engagement and making healthcare approachable, because it's something that people not only currently are maybe ignorant about, not intentionally so because it's complicated, but are oftentimes avoiding because it's costly. And so our goal was to bridge that gap and make it very engaging and approachable and friendly and fun. And so that's kind of how we approached it, not even thinking that we were gamifying it.
It's really interesting, yeah. I keep hearing you guys say engagement, engagement, engagement. And it's really interesting because health communication has evolved over time to really stop being just about giving people information and trying to drive behavior change through participation and individual action. What have you guys found really engages your users? What sort of principles of gamification do you guys use to engage different consumers that you have?
Well, just a second about what our product is, because it might give some context for that, which is the product sort of has two parts to us. There's an activity meter, which I'm holding in my hand here, which is really just a simple accelerometer, which kids helped us design. And it's intended to try and be low cost, accessible. Kids lose them, we want to replace them, so we've tried to sort of optimize that. And then the website is really where we've manifest all the gamification features. And what we've done there has really been sort of to constantly sort of test different things, research them. Many of the tools that people have talked about all day here at the conference, whether it's badging systems or leveling or leaderboards or creative ways to earn points, are all integrated in the site. But we've done those sort of in a deliberate way through randomized control trials to sort of see what is ultimately impacting behavior change. And one thing about Zamzee that's sort of kind of distinctive is we know it works. The research we've done shows that kids who use it move at least 30% more than kids that don't use it, and in some cases we've seen it as high as 80%. And I think it's to answer your question, I think it's the holistic nature of all the different engagement features. But a couple things in specific is the way we reward points. We really reward improvement in activity rather than raw activity, so that whether you're a couch potato or a super athlete, there's still a relevant experience, and we sort of provide bonus points and bonus earning for you no matter where you start from. And we've also spent a lot of time optimizing the reward structure, which is a complement of intrinsic and extrinsic rewards. And we basically just learned not to reward too much. There's an optimal place we found where we think it makes sense, and we sort of really try and move kids into the extrinsic motivation, and sort of the gamification mechanics really make that possible.
What have you found specifically about rewarding too much?
That it's not necessary to get the behavior change we want. There's actually some studies done where kids were given the potential to earn about $5 a month and $20 a month, and the behavior change we were looking at was, it made a difference, but it did not make enough of a difference from a cost effectiveness point of view to sort of need to reward at that level. And you can get a lot of the behavior change you want at a very modest level.
That's very interesting. So what about you? What have you found as far as driving engagement from your users using gamification?
Okay. So, from UnitedHealth Group's perspective, we've seen, and similar to what you're saying, there is no one specific set of engagement mechanisms, whether it be rewards, whether it be a monetary, money back on something, whether it be just a recognition. And really, what we've found, it's really driven by the audience that we're trying to go after. Something that we would put together for a senior population is very different than something I'm going to put together for a young, bunch of kids. Kids are very interested, and it may not even have to be something that costs money, but it could be something that they want to be recognized for doing. It could be as simple as a Zamzee product that's been customized to their taste. It could be something as simple as putting them or getting them an avatar, and their avatar now has a special badge, or maybe their character in the game has special powers. For that population, we found them to be very receptive to that. Again, our senior population, they want to really drive in, and they want things that will be different for them, things that will help them in their lifestyle. So what can we do to help that senior population? The intrinsic versus extrinsic is also something very, very interesting to us, because the intrinsic rewards are much more long-lasting. We found that to be much more long-lasting in the changing people's health behaviors. The extrinsics have been really good at getting people out there to do things and get them started and getting them involved. And so we've been playing around with that. But there's no one answer in our business, and we're finding success in all those areas.
Well, how we started, we started focusing with the finances, because there's something very tangible to the average person about money, right? You either have it or you don't. And so if you understand, for those of you who are in healthcare, if you understand what's happened in the last 5-6 years, this dramatic shift with the costs and the way they've been passed down to the individual, there's been a huge gap that has occurred with the education process. So there's a lot of responsibility being pushed down to the individual, but not a lot of education about what that means. So the way we look at it is how we surface that information and what everything we do is around what are our users trying to do and what are they trying to answer by using our product. We've just done a redesign of our whole product to surface information so easily and quickly and in a friendly way. And that actually surprisingly was what people were hungry for, was more information. So what we found in the healthcare industry is, for consumers anyway, with all these costs being passed down to them, is there's been kind of a negative reaction from them. So, and this happened to me. Take an example. I went to the pharmacy in January to refill a prescription, and all of a sudden they said, okay, that's going to be $150. I said, well, what do you mean? I said, oh, well, you have a deductible now. And that's a very common thing that's happening. So that's kind of a negative reaction, that where we've started with ignorance, as I said, like people just don't know a lot about their healthcare, to then, there's this negative reaction to avoidance. So knowing in this continuum of avoidance and uneducation about healthcare to fully engaged and super knowledgeable, that's how we're trying to insert information in a playful way to leapfrog them out of that avoidance state that they're in, so they can understand and make better decisions. And that's what we've learned. It's really about the information, how friendly and how easily we can present it in a way where they don't even have to go try to figure it out. They just go answer that question.
That actually ties into sort of my next question, which is, in healthcare, it's so important to create sustained behavior change. And one thing I think everyone who works in healthcare has sort of encountered is the fact that human beings are apt to fail when they set a health goal. So how do you guys incorporate any sort of features for failure when somebody doesn't do what you want them to do? When a child is not active, how do you keep them on track and not necessarily make them feel bad about not achieving the desired goal or outcome?
A couple things I'd say about that. I think how you handle failure with kids in our age group is really, really important and delicate, because I think you could quickly alienate kids, as is obvious to anybody, with sort of negative messaging. And so I think one of the issues I mentioned is, even if you're a quote-unquote couch potato, we are rewarding just a mere improvement off that activity. And there's lots of positive messaging, badging, leveling up possible even at that level. But if you take one of our challenges, and we have sort of a whole opportunity for kids to set goals for themselves and pursue them, not all of them are success states, but we don't really talk about failure as a failure state. It's sort of a try again state, or nice so far state, or something that sort of reinforces kind of some key issues around intrinsic motivation, whether it's reinforcing your competency or your autonomy, sort of meaning, relatedness, and I think our fifth one is it's missing, but sort of the things that we sort of try and reinforce, and we don't sort of treat it as failure. We treat it as sort of an opportunity to sort of learn and improve and remessage that. And I think the other thing we've learned, and again because of the age group, parents play a critical role in keeping kids engaged in our experience. And so we've actually, if failure is kind of disengaging from our experience, it might be because they get bored, but it's often for a lot of other logistical reasons in this age group, and the parents can play a really important role. And so we're actually building out features to make it easier for mom and dad to see their kids' site, give them positive reinforcement, reward their activity, and I'm confident going forward we're going to see that as more and more part of the product is a family product, because in addition to that, it also increases engagement. We know that if it's done in a group setting, that we're going to see much higher engagement by kids than if they're doing it alone.
And I would agree with your points on the family involvement, specifically with kids. We did a whole study with what's called our Join For Me program, which is around children with diabetes or pre-diabetes coming on with that. And what we're really trying to do is we put them through a 16-week program of education, exercise, nutritional analysis, and we help them understand what is going on in their life. And what we learned very early on, that it can't be just about the kids. It's got to be about the entire family. And even though it was focused on the kids who were identified for this program, the results actually ended up improving and helping the entire family. It's not that everybody made it through the program. It's not that we saw all the results with everybody staying in it for 100%. But we did see that the engagement in that program and the amount of time and the amount of families that stayed in it much higher than are typically within our programs. When kids do, or when anybody does this, or when they fall off of the wagon or they aren't able to meet the goals, what we know is you have to set attainable goals. And your goal versus my goal versus someone else's goal is very different. And we've got to set those attainable goals, and you can't make them just uniform for everybody to try and hit. And once someone doesn't make that goal or something happens along the way, you've got to do a course correction. You've got to put a new path or a new set of challenges or a new set of rewards in place that do incent them to try and move along that path. And that's where we're trying to take some of our studies.
Now, we don't have the same type of rewards or influence on behavior like following up. Not yet anyway. That's something we'll build out in the future. But applying some of the same principles to engagement with at least keeping track of what's happening, staying on top of your bills, your claims, and your deductibles, is the notion that we can not only do a good job of explaining what happened in a friendly way, but if we attach some sort of incentive to that view, such as a discount or a savings, people are looking for something like that. So it's slightly different model, but same techniques. We find that the open rates for those types of explanations are pretty high because people are trying to stay on top of it already. But if we can add a tangible reward to that, it goes up even more.
K-Health is a really interesting example here because sort of the money is its own reward in this case. If you save money, then you will be rewarded and hopefully keep using the product. Which sort of ties into my next question, which has to do with behavior change and outcomes and monetization strategy. So do you think that it's necessary to tie your outcomes to how you monetize your business? So if somebody succeeds or fails, is that going to directly tie in whether or not you profit or make money off of that behavior? Do you think that's necessary?
So from UnitedHealth Group perspective, we kind of look at the fact that someone will succeed or fail. We know that a certain percentage of the population is going to succeed and fail within a program. From our perspective, it's whether we make money or whether the person gets those rewards. Again, it depends on what you're trying to incent. Are you trying to incent them to get to a certain point and do certain activities and get things along the way? And if there's a monetary tie to it, certainly, you should try and reward them along the way. From a UnitedHealth Group perspective, if we create programs like that can help people get healthier, whether they make all the things or not, it'll be good for us. It'll be good for the system because hopefully they become a little bit healthier. And we can help lower the overall medical costs for that employer. We can lower the overall medical costs for us. We can for the doctors and everybody along the way.
You would assume also if consumers are also saving money that would also certainly be beneficial as well.
Oh, definitely.
I would say for us, we have a number of ways of thinking about monetization of the business, and I think our research results speak very compellingly to third-party payers who are interested in addressing the problem of physical activity in this country, and so being able to continue to demonstrate that efficacy. I think one of the challenges is when you're dealing with a young population, the benefits are many, many decades off, but I think that increasingly, there's more sophistication and interest in long-term prevention initiatives, so I think our research is compelling there. And in the parent context, I think one of the things they're looking for is physical activity, but they're also just looking for sort of healthy family dynamics, and I think those are the things that keep them engaged and cause word of mouth and keep people coming back for our product.
That's really interesting. One of our most recently incubated startups, Health Rally, has actually incorporated a platform for the entire, either your friends or your family. And so it's interesting to see how all of you are sort of engaging different groups of people around maybe individual behavior change. As far as sort of the future of gamification in health, where do you see it going? I know you mentioned prevention. Where do you think it's going to have the biggest impact? It sounds like right now it's really big with health and fitness. Are there any other areas, maybe drug adherence or something like that, where you think it'll really extend to?
I think if you look out, whatever, probably even 5 years out, we're going to stop talking about gamification of health because it's just going to be the way things are done. There's going to be rewards, there's going to be incentives, there's going to be ways of engaging people in very different ways. And getting and keeping people involved in that, like you said, it's a long-term thing, is not just something we do now, and it's not going to be something that's going to go away in 5 years, but it's going to continue to evolve, and it's going to continue to always be there. People who are healthier, manage their health, want to be rewarded for being healthier and managing their health. People who have conditions, and we've got some condition management programs where we bring gamification concepts into it. I think that's going to be in a way to keep people engaged in those programs, to keep them involved, to keep them coming back. And again, like I said before, it's not just a one-time event. You got to think about the sustainability. You got to keep it going, and it's just got to keep that evolving that story so people can continue to level up every year that they stay in this program.
I completely agree with Bob, and so rewards in general in healthcare are not necessarily a new concept, but I think the way it's being done is evolving, and I think the critical factor there is data. And so previously we've seen a lot of self-trackers or things that rely very much on input of the end user. And partially that is because of the infrastructure of the healthcare system, which is also evolving. And so what we're seeing now is much more analytics around what those rewards are and the triggers that could incentivize people. So that's where I think the real interesting evolution is. And as more of this data becomes available and is not locked in paper and becomes more fluid, I think we'll see some really interesting things happen with rewards for end consumers.
Well, we're actually out of time, unfortunately. I think we could probably squeeze in a couple questions from the audience if anyone has any burning questions they want to ask our panelists. Sure. We actually can't hear you up here.
Shout.
Yeah, you can just come on stage. That's fine. Come. Do you want to repeat the question as well?
So the question, you want me just to read it?
Yeah.
The question was, what do you do about the privacy concerns around the data? Where other people are using gamification, they don't have these issues. In healthcare, we have big issues around it. For many of our programs, the consumers still own their data. They still own it. But it's like anything that's out there, and this is something that's going to have to change a little bit in our psyche. It's not that you're giving away data. It's not that you're giving away all of your health data. But if giving some of your information and letting people use your information to help guide you or provide services is a benefit to the system, it shouldn't be bad. That should be a good thing. And it really ultimately falls on the consumer to be able to say, yes, you can use it, you can't use it. But for those people who want to use it, they should have the ability to opt in. They shouldn't be blocked from letting people do it.
We have also the additional issue, which is we're dealing with a population under 13, and so in the online environment, we have to comply with the Child Online Privacy Protection Act. So our site is really locked down. There's no opportunity for people to exchange private information, and the information we're collecting is activity data, and while in some contexts that might be healthcare data, but we really try and create an environment that's trusted for parents, and so it's not, it's also one of the challenges, is trying to sell to a population that age, but that's our challenge.
I know we've had a challenge with how do we get viral, and what can we share? We don't necessarily want to tweet your claims, or that would just be a really bad idea. But so there has to be some smart disclosures around it. And as Bob mentioned, the patient has the right to access their information, and beyond that, they have the right to do what they want with it. Now, within our app, we just have to make sure that we're facilitating the right things, and outside of that is their decision.
One more?
how would gamification play a role in altering physician behavior?
So I'll take a stab at that one. You know, and so you bring up a good point. Getting the physicians really involved and giving the physicians tools to engage their patient population, to giving them tools to be able to do different things is going to be critically important. As healthcare reform comes along, that's really kind of what you see happening. A lot of the risk is going to be pushed down into various populations. Consumers have more risk, the physicians are going to be taking on more risk, ACOs is part of that, and it just changes the whole model. Some of the things that we're looking at, the tools I think all of us have talked about here, are tools that can be applied to that population as well, that they could be offering to their member base and should be offering to their member base in many cases. You know, there may be some gamification mechanics and things around in there to help incent physicians to do things differently as well. I don't know what those are yet, but I'm sure there will be some opportunities for that as we advance.
Did you guys have anything you want to add? Well, thanks so much for coming.
Doctors have to move too.
Doctors have to move. Thanks so much for coming, and I believe we'll be around a little bit afterwards, after the panel, if you have any other questions that you might want to ask.